Hello.
Hi.
Hello. All right, so it is 1:04. We are going to get started. And I just want to welcome everyone here. This is Motivational Interviewing Part 2. Many of you may have joined us last week for Motivational Interviewing Part 1. If you attended MI Part 1 last week, would you just drop a number 1 in the chat for us? So if you joined us last week for Motivational Interviewing Part 1, we just want to see who our return participants are. Drop the number 1 in the chat for us. Thank you. I also want to just kind of make you aware that this is being recorded. So if you see the message going across your screen that says this message is being recorded, I just want you to click OK so that we can keep this moving. Also want to share with you that this is a CME credited course webinar. So just a little bit of information around disclosure. Augustine, if we can go to the next slide on that. Yeah, so this is just a disclosure that this is a continuing education webinar. This spending the entire time, which means you would have to remain here from the beginning to the end. You would then be qualified to receive 1 hour CME. And this is for various professions. So it's accredited for ACCME for our physicians, also pharmacy, nursing, and various other professions. So at the end of this webinar, you will receive an email that will lead you to a link for you to go in, fill out the post-evaluation, and to claim your CME credit. Oh, we see several people were here last week, part 1. So also want to share that our speaker today is not being paid, or the information is in no way manipulated or structured in a way to sell or promote any items or products. This is a continuing professional education course. Thank you, Augustine, for that slide. We've gone through the disclosures. Thank you for that. So without further ado, we want to bring up our speaker of the hour. So this is Motivational Interviewing Part 2. If you joined us last week, thank you for coming back another week. We are going to, again, dive into Motivational Interviewing Part 2, building on the principles and foundations that Francesca shared with us last week. A little bit about Francesca Viola Hamilton. She is a licensed clinical social worker with nearly 2 decades of experience specializing in supporting adults and families through complex mental health challenges. Her background includes extensive work in child welfare and juvenile justice settings in the New York City. She holds a master's degree in social work and criminal justice from SUNY Albany, New York. And her clinical approach, I would say, is certainly approach that is grounded in evidence-based practices. She does a lot of work in advanced training in cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, and structural family therapy. So we are excited to have Francesca here with us today. She is also the owner of FVH Counseling, where she provides therapeutic counseling and clinical supervision and consultation to clinicians across New Jersey, New York, Connecticut, and Pennsylvania. So welcome, Francesca. I will turn this over to you a bit more. Yep, there we go.
Okay, great. All right. So sorry, I was a little ahead. So this is the second part of our training, driving change. And last week we focused on the basic components of motivational interviewing and the stages of change. Now we are looking at how do we implement those processes more effectively. Oh, I did not mean to do that. So The training summary for this week is just building on the foundations of motivational interviewing skills, focusing on strategies for implementing MI in clinical practice. For all of you, the goal here is to learn how to invite change talk effectively, respond to sustaining talk, and develop actionable steps and goals with patients. So the first thing I'd like to do is to pop up a pre-test. I wanted to see how familiar everyone is. There's 5 multiple choice questions. We're going to put 2 minutes on the clock. You know, this, you're not being judged by this. Pick whatever feels correct. Can everybody see the poll?
Answering the questions to the poll will just drive Francesca's her process and how to keep moving forward with the presentation. So your participation in the poll is greatly appreciated. That way she'll get straight to the points. And if we have an experienced group here, we won't spend time on a lot of the basics, but she'll focus the webinar on exactly what you need. So thank you. Answers are coming in. Great.
Okay. Okay, so I'm going to end the poll here. Thank you so much, everyone, for answering those questions. So let's review the questions. So first question was, which of the following is an example of change talk? And most people picked, I know I need to schedule that screening, which is the correct answer, right? So when we're thinking about change talk, we're thinking about things that are actually inviting taking some action and actionable steps. So great job. Next question is, what strategy is most effective for addressing sustained talk? And vast majority of people chose reflective listening and exploring values. Once again, very accurate, right? So we're really looking at what is the client patient saying? How are we helping them sustain the choices that they are making? And how is it aligning with the things that they value the most and their own goals, right? What is the purpose of SMART goals and motivational interviewing? And everyone, I guess some of you have some familiarity with this. Great. To create clear, actionable steps. Absolutely. 100% correct. So wonderful. Which of the following is an example of inviting change talk? And most people said, what would be different if you scheduled your screening? Absolutely. This is a great way to exemplify how we are actually engaging patients in creating goals for themselves and moving forward on those goals. Wonderful. And last question, what is one key step to creating a personalized motivational interviewing plan. And once again, identifying patient types and tailoring strategies. Absolutely, right? Everything is about what the patient would like and how are we going to make it easier for them to follow through on these goals. Excellent job, guys. Thank you so much for participating. So, learning objectives, right? So in this course, we're going to identify methods for eliciting change talk and responding to sustained talk. We're going to apply motivational interviewing strategies to guide patients towards actionable steps. And we're going to develop personalized implementation plans to integrate motivational interviewing into everyday practice. So in this training, I do want to encourage all of you to ask questions. By all means, please drop your questions into the chat. You can also private message myself or Nikel, and we are going to take a couple of moments at different times throughout the training to open up the floor to everybody and really think about how things might be implemented in your setting with your staff or other members of your care team in response to the needs of your patients. Okay, so brief recap. So some of the key takeaways from last week's training, we talked about the stages of change, pre-contemplation, contemplation, preparation, action, and maintenance. And we discussed the OARS framework, which is what guides the conversations that we have with patients. So let's talk about change talk, right? So in change talk is essentially any statement that indicates a readiness or willingness to change, right? I know there's a lot of acronyms going on here, so a lot of times it can be very confusing when you are thinking about, oh, sorry about that, when you are thinking about how to think about these things. But we use something called DARN-CAT, which is a framework that is structured around how do you utilize these conversations that you've already had and create actionable steps for a patient to take. And we divide it into two parts. The first is preparatory change talk, which is the DARN, and mobilizing change talk. And the way I usually like to think about it is the DARN part is what am I doing now to encourage my patient to think differently and verbalize things differently. And then the CAT is now what's the plan? Okay, so DARN in the simplest terms stands for desire, ability, reason, and need, right? So simply put, desire is what is it that the patient wants in this moment, right? Do they want more options available to them? Do they want to improve their health? Do they want to improve their communication? How does that look for them? What is their ability, right? So when we think about the things that clients can do, and hopefully within the previous conversations or earlier part of the conversation that you've had with them, you are looking at what are some barriers that your patient came up with, and what are some things that they've already identified they can accomplish, right? Next one is reason, right? This really ties directly into a patient's values and goals for themselves, right? They're verbalizing at this point that they understand the importance of whatever it is that needs to be done. And then the last one is need. This may be looking at patients who have now accepted that there are things that need to change, and they are recognizing the importance of making these changes for themselves, right? Because it does eventually help them meet their goals. So the second part now is the CAT, right? We're talking about change talk that is actively engaging in functional outcomes, right? So there's a commitment component, right? A statement that is indicating a willingness to follow through on something, such as I will take on the ownership of making an appointment, I will secure transportation. There's a step that's going to be taken. Activation. Here we have, I am ready to do something, right? I'm thinking, this is something I can do. I can do this next step. I'm ready to do this, right? And then the last one is taking steps. So maybe this is somebody who has already started taking some small movements towards doing things. So let's say there was a conversation around setting up an appointment, and now your patient has come back and said, I've set this appointment up, and I now have to, figure out how I'm going to get there, right? So there's definitely something happening in that is showing some sort of action. Okay. So once you've gotten past the point of change talk, now we are looking at sustaining that, right? So what are we doing in this moment to help our patients actually get to where they want to be, right? So here we're looking at statements that are either resisting change or highlighting barriers, right? And this is really important to note that even though you would have your patient going through the process of making changes, there are still practical and tangible barriers that are coming up for them that they may not necessarily have the ability to sustain on their own. So this is the goal of Sustain Talk, is to really highlight these things and to help us come up with ways to sustain all of that change talk, right? So some of the examples are, I've tried quitting before and it never works, or I've already had this kind of scan and my results were negative. Why am I doing it again? Right? So again, some of the strategies that we're using to address this is thinking about reflective listening as a tool, right? And so for those of you who were present last week when we were talking about the OARS framework, reflective listening was really just repeating and responding back to the patient what they have told you, right? And using different techniques to highlight either changes that they're looking to make or conflicts that they're bringing up, and tying it back to values. We also want to emphasize the patient's autonomy, right? We do realize that for a lot of patients, there are lots of different reasons why engaging in certain types of activities regarding their health are a challenge, right? And so we don't ever want to have a patient feel like they don't have a choice, but we also want to emphasize the benefits that these types of choices have in terms of their overall health. And finally, we want to make sure that we are exploring their values. If your patient is sitting in front of you and talking to you about how much they enjoy being a grandparent and they want to be around to spend time with their children, and on the same token are challenged by the idea of engaging in certain aspects of their health plan, these are things that you can utilize as motivation for them to reconsider their belief that they can't do this thing. Okay, so how do we invite change talk, right? There's lots of different techniques that we can utilize. The most common is asking evocative questions, right? So really just inviting conversation around concerns, barriers, feelings. So, here we have what concerns you about delaying you what concerns you about delaying your screening, right? But also what are some of the concerns you have about the possible outcome, right? For a lot of patients, it's not necessarily the action that they would be taking, but whatever might come afterward, right? You want to explore pros and cons. What would be different for you if you completed the screening, right? What are some of the things that would improve for you? What are some of the things that would be harmful for you, particularly if there's a screening where there might be, the use of certain medications or certain materials, right? Thinking about past successes, particularly if this is a patient you've been with for a while, you may have more knowledge around other times where this has been a challenge for them. This would be a really great opportunity to think about that. And there's always the ability to use importance and confidence skills. A lot of you all probably use something similar when you're thinking about rating a patient's pain. You would probably be using the same exact thing for rating their willingness to engage in certain types of activities, right? And so using a scale of 1 to 10, with 1 being it's never going to happen, with 10 being I'm ready to do it like this second, you can use that as a tool to assess how ready your patient is to actually follow through on certain things. And then what is the response that we should be having to change talk, right? So we have reflective statements to reinforce motivation, right? So all of the reflective listening you were engaging in, now we're going to use some of those statements to really tie it back to how your patient is going to follow through, right? You want to affirm, right? You want to validate how they're feeling, but you also want to give them hope, right? You want to highlight their progress. And then you want to summarize everything, right? Things that tie all of these key points together and make it easier for you to engage in certain activities, right? So, oh, I'm sorry. I don't know why that went back into that mode. All right. So the next step here is developing action steps. So I want to take a pause here and see if anybody has any questions, any comments. Is there any examples that can be provided about times where you've used something similar in your practice with patients? And feel free to drop into the chat as well. For those of you who were present during the last week's training, is there any overlap for you that you're witnessing or that you've seen in terms of maybe taking some steps in your own practice? Okay, so please, feel free to think about, all the things we're talking about here. And I would love to hear from you all about how this might work for you. Okay, so developing action steps. So after you've had these conversations with your patients, now we got to figure out how do we put these things into action with them. So the key elements are establishing realistic, meaningful goals and encouraging the patient to generate their own solutions, right? For those of you who have been doing this for a long time, you know that if you tell somebody what needs to be done, more than likely that's not going to happen, right? But when people actually engage in their own goal setting, they're more likely to follow through on these actionable steps because they have ownership of it. They've been empowered to think about it more concretely for themselves, and they now know that it is something that they chose and they are the ones setting it up. Okay, so here we have our pretty graphic, which is SMART goals. How many of you have heard of SMART goals? Anybody? Rosa. Anybody else? Rosa, Anna, Aza, Nikel. Okay, so does anyone want to tell me where they learned their SMART goals from?
We've opened up the mics, Jessica.
Okay, so Shariah said from quality improvement work. Anybody else? Staff performance. Okay. Interesting. Can you talk a little bit more about that, Anna? Okay, measuring the quality of the goals and their targets within their roles. Okay, great. Has anybody here ever developed a SMART goal with a patient before? Oh, Rosa, okay, so it's embedded in your care plans. How does it work in your care plans?
Hello. So it depends on the particular program, but for example, if we are asking someone to make a lifestyle change, for example, in their diet, we ask the participants what what they would like to change, what they feel ready to change, and then we ask them like, when do you think you're gonna do this and by when? And so it becomes in that conversation naturally of setting the SMART goals, and during follow-ups we will check in of how that went.
Excellent. Great. Thank you so much for sharing, Rosa. I really appreciate it. Does anybody else have any other ways that they've learned about this or how it's implemented in your particular setting? Oh, substance abuse counseling. Absolutely. And in fact, SMART goals, I think that was originally how they were initially developed, was for use in substance abuse counseling. Absolutely. Well, thank you so much, guys, for sharing. I really appreciate that. So these are SMART goals, right? Most of you have heard about them. For those of you who haven't, this graphic is a very brief explanation of what they look like, right? Each letter stands for a component of the goal. S is for being specific. It's about making the goals clear and specific, measurable, right? So you want to be able to determine that you are actually either working towards this goal or you're meeting the goal, right? The goal should be attainable. It should not fall too far outside of what your patient can accomplish. The goal should be relevant. So it should be associated with whatever it is that you're working on at that moment. And the goals should be time-based, right? And this is part of being more evidence-based in your thinking and practice, right? There should be a goal. The goal should actually say these will be completed within this time frame. Okay. So when we're thinking about motivational interviewing in action, in particular, when we're thinking about how it works with our other steps that we are taking with patients, we are thinking about having a patient-centered and collaborative approach, right? We're obviously looking to resolve ambivalence, and we are inviting change talk, sustained talk, and guiding the patient towards actionable steps, right? now that we've covered all of the components of motivational interviewing, stages of change, and now sustaining, inviting change talk and sustaining talk and setting up SMART goals, now we're going to look at how do we do that, right? So inviting and responding. So a lot of these are basically scripts, right? Most of you may already be doing this, and doing it without realizing that you are doing it. That's the wonderful part about some of this stuff. It is very much based in how we already communicate with each other and common sense, right? So here we have a short script around a practitioner inviting the patient into thinking about changing something, right? So here it's like, I understand that it can be tough to think about getting a screening. Can you tell me what makes this important to you, right? So we're inviting change talk, but we're also utilizing open-ended questions, right? Patient is now describing what some of their barriers are. They know that cancer runs in their family and they want to be proactive. So we've an identified value here, right? But their thing is, I'm not sure if it's really necessary right now. So it sounds like you're concerned about your family history and you want to be proactive about your health, but you're uncertain about when it's time to take in action, right? So you're responding to that sustaining talk, but you're also utilizing reflective listening. You're not just parroting back to them, but you're identifying challenges and barriers and addressing concerns. And the patient's like, yeah, I just don't want to deal with the hassle, and I'm not sure if it will really lead to anything anyway, right? Does this sound familiar to some people? I would think probably most of you have had at least something similar to this conversation before, right? So now we're talking about how do we respond to that, right? It's kind of a heavy conversation, can be really difficult. When you have a patient in front of you like that, you're saying, it sounds like you're not sure if the effort is worth it. And I hear that you're weighing whether the possible benefits justify the hassle. So we're reflecting that sustaining talk. We're allowing space for ambivalence. We're also, once again, using reflective listening. And we're also identifying the conflict between what the patient wants for themselves and what they are concerned about. And the patient's responding with, I guess it could help catch something early if there's an issue, and I want to stay healthy for my kids, right? Again, another value, right? Something that we can identify. And we are now recognizing that there's some change talk emerging here. So actionable steps and a SMART goal, right? So now as the practitioner, you've mentioned that your family history and your desire to stay healthy for your kids are important reasons to get screened. What do you think would be a good first step towards making that happen, right? So we're guiding them towards actionable steps. We're empowering them to make some decisions for themselves, and we're setting up the SMART goal, right? Because right now we are identifying what is sustainable. Maybe I could call the clinic to ask about the screening options, and it might not be as bad as I'm imagining. Great. So we have something that's very realistic, very achievable, right? We're moving towards it being somewhat time-based because we can utilize this movement to say, when can we make that happen, right? So again, so that sounds like a great start. We're validating, we're affirming, right? Setting up a call can make it easier to move forward. How do we set a goal for when you can do that, right? So we're guiding them towards that goal setting, right? I can do that by Friday. I'll make the call. Fantastic. It sounds like you're ready to take that first step, and I'd like to support you if you need anything throughout this process. So again, right, very straightforward kind of movement with the patient, but we are letting them guide the way. And they are taking what essentially looks like a very small step, but it is actually a lot larger than they recognize for themselves. Okay, so we've gone through the motivational interviewing process in a nutshell. We have identified what change talk and sustain talk look like. We've moved a patient into an actionable step, and we have set up a SMART goal, right? This entire process is really just to support patients in resolving their ambivalence. We want to enhance their motivation, and we're setting clear steps for behavior change. Okay, so let's talk about the challenges. So I want to take a moment here and I want to ask people in that previous couple of slides where we walked through this script with a patient, right? Are there any things that came up for anybody that's like, oh my God, that would never work here? Or, you know, we've done it this way and we've had really good results. And feel free to drop it into the chat as well. That's totally fine. Okay, so let's think about some of the common barriers that we have here, right? Time constraints, number one, right? How many people here are reading through all of this, listening to, you know, what we're talking about now and what we talked about last week, and just thinking to themselves, I could never do that because it would be way too time consuming when I am having an interaction with a patient? And feel free, be honest. This is a safe space, I promise.
At times, I would say that at times it happens because we're also connecting with participants and we're trying to meet their needs. And sometimes they let us know, or we feel as if they don't want to no longer be on the call or be present because they have somewhere to go. So certainly time constraint is a barrier. We just have such limited time that we are trying to get our message across and at the same time trying to do some motivational interviewing, which is hard without that time. So certainly it's a barrier.
Yeah, thank you, Rosa. I appreciate it. Yeah, I mean, time is always a constraint. Yeah, time constraints always an issue. And I know for the vast majority of all of you, you maybe have anywhere between 10 minutes, 15 minutes. I'm trying to think back to my own interactions with my doctors. And yes, it does sometimes feel like a very short period of time where you get to sit and have a conversation with somebody, right? And so a lot of times, you know, there is a belief that, you know, motivational interviewing has to be done in completeness in order to get the desired outcome. And that's not necessarily the case. You know, if you're thinking back to stages of change, every single patient comes in at different stages, right? And I'm so sorry if I say your name incorrectly. Please correct me. Abdel Karim said patient resistance, not ready for change, pre-contemplation stage. Absolutely, right? So you may have a lot of patients who are coming in, excuse me, in the pre-contemplation stage. They're already not really looking forward to this. However, you may have a patient who comes in the contemplation or action stage, and it's like, oh, this is actually a lot easier, right? So it definitely is different for everyone. Oh, and thank you. Great. I'm glad I said your name correctly, right? Patient resistance. A lot of times the resistance is really based on a lot of different things, right? You know, I'm going to say a couple things, but if you guys can think about things that contribute to patient resistance, I imagine that a lot of it has to do with a lack of understanding or knowledge. about what's going on. Right? Sometimes it's just about not really understanding what the expectations would be. And you probably all have seen different reasons come up for people. And then competing priorities. Way back at the end of last year, we had a panel discussion where I think many of you were present at. And somebody had mentioned working in an area that was a tourist destination, and a lot of their patients were employed at hotels, resorts, and a lot of the work being done there was shift work. But also, if there was, overtime to be had, that you would lose patients, they would be canceling appointments because they would be picking up extra shifts, right? So understanding that, patient demands for outside of their health oftentimes really are more prevalent or present for your patients than coming to an appointment, right? And so some of those solutions are integrating motivational interviewing techniques in more brief interactions and building rapport early to increase engagement. And many of you I know in your settings do things that do allow for that. Like having community workers who are attending events in the community, providing information, having conversations, doing mobile breast cancer screenings, all sorts of things to do that. Okay, so key takeaways here: change talk, right? How do we get to it? How do we encourage it? What do we do to sustain it? How do we ensure that patients are consistently feeling motivated and they have their autonomy at every point in the process, right? Actionable steps, right? So, what are we doing in these settings to invite change talk and turning it into actual steps to be taken, right? Reminding ourselves that, patients do have other priorities, but also trying very hard to encourage them to take more ownership of their health and to do it in a way that is still honoring their values and their goals for themselves, right? SMART goals. How are we creating these very reasonable, measurable, achievable, time-based goals that are sustainable, right? Short, sweet, and to the point. It should be something that a patient feels confident in doing. It should be very achievable. If it's a more complicated goal and requires some more steps, hopefully we have established with them some support systems, or we're offering them some things that they can utilize in order to achieve those goals, right? And then we're talking about next steps. What are we doing in order to ensure that we are engaging in some level of follow-up with the patient, either to help them meet their goals, or if they were unable to do so, to try and address barriers with them so that we can get them back on track. Okay? And I'd like to open everything up now to everybody. I would love to hear if there are any questions that you might have. I know that there was a survey sent out last week about, just thinking about how you can incorporate motivational interviewing into your own practices. I'd love to hear if anybody has had any successes that they'd like to share, or if there have been any challenges that they've come up against. This is an opportunity for you all to get some feedback from each other and from myself around this. And please feel free to ask any questions. There's no such thing as an unimportant question. I love it when people ask me questions. It makes me feel special. And I do want to let everybody know that you will be getting a copy of this PowerPoint. And there is also a handout that you will be receiving that's actually summarizing both trainings together. And it would serve as an outline for you and your staff to utilize if you'd like, in terms of just, learning ways to implement some of these steps in your own practice. You're welcome, Rosa.
Thank you,
Okay.
Fran. Looks like we have a quiet group here
Yeah.
today. Thank you so much for the presentation. And please, if you have a question, take advantage of having access to Francesca now. Feel free to unmic, ask a question. So we'll give another minute. And then we're going to move on to share next steps, what's coming next.
So I did get a question. Sorry to interrupt.
No, go ahead.
The question was, do you have a list of change talk and sustain talk questions that helps direct and guide the conversation to share? So offhand, no, simply because a lot of the times the questions will be tailored to whatever the conversation is. I will say though, and I'm just going to stop sharing my screen for a minute. One of the easiest ways to engage and have conversations with clients is to really focus on statements that are going to actually mimic sort of what they are saying to you. So when we're thinking about reflective listening and we're looking back on what they have told you, right? You're looking at asking questions that are in line with the things that they have said, right? So if they're saying to you, I want to improve my health, right? Then whatever question you're going to ask is going to be reflective of that, right? So how are some of the ways you might want to improve your health, right? What are some of the challenges that you have for doing that, right? You may want to ask questions that have a little bit more of a narrow focus and giving them something to work on. So any of these questions would be really based in whatever it is that they've already said to you. But thank you for asking that question. That's really helpful. Maybe that's something I should do. Work on a list.
Yeah, a list of common questions.
Yeah.
Commonly asked questions and answers. So that would be amazing. So if Francesca, if you decide to work on that, we'll be sure to share it with this group.
Absolutely. Absolutely.
Yes.
Any other questions, comments, feedback, please feel free.
All right, we're 5 minutes into the hour. So we are going to just again say thank you for giving us your time, sharing your time this hour with Francesca and this team. Again, we want to thank HRSA, Health Resources and Service Administration, for funding and making this happen for our healthcare professionals and the health centers. So it looks like there's a quick poll, and then we want to move into share with this group what's coming up next. So there's one more poll for you guys, it looks like I see here.
And again, nobody will be graded on this poll, I promise.
Mikkel, are we getting any responses on the poll? Oh, okay. Okay. Okay, so we've had 10 out of 18 respondents. That's great. Thank you. Thank you for your participation in this poll. Now, Cal, would you like to share results? We have 4 minutes and we have to wrap up and with what's next. What is HRSA providing next for the healthcare centers?
Okay. Thank you guys so much for participating. So let's go through the questions real quick. First one is, which of the following is an example of sustained talk? And many people picked, I know I need to make a change. That's actually an example of change talk. The best answer is, I'm not ready to quit yet. Right now, we're talking about a client that is challenged by the idea of making a change, and their talk is reflecting that, right? So remember that sustained talk is really identifying barriers and resistant to change, right? So examples of, I tried quitting before and it never works. So that's something to keep in mind, right? Next question. What is the key purpose of responding to change talk? And once again, you guys got it on the nose: to reinforce motivation and encourage action. Okay. Third question, which technique best encourages change talk? Asking evocative questions, 100%, right? We want them to really think about the ways that they can do this on their own. Number 4, what is one benefit of using SMART goals in patient care? And overwhelmingly, they help patients create clear and achievable steps. Absolutely 100%. And the last one, how can healthcare workers best integrate motivational interviewing techniques in practice? And the best answer here is just by applying motivational interviewing strategies consistently in all patient interactions. Great. Thank you guys so much for your participation. You were great today. And I really appreciate your presence here. Turn it back over to Tanya.
Thank you, Francesca. Thank you for all the valuable information you shared. Augustine, I'm going to turn it over just to share with the group what's coming up next by way of professional development activities. Can we get that in full presenter mode?
Sure thing.
So we have a workflow excellence webinar that's coming up on July the 9th. So if you are looking for ways to improve processes to get your more patients through the door with less bottlenecks, we have here Vaughn Barker, who will be with us on July 2nd, specializing in standardizing care processes to create consistent, high-quality outcomes. We also have our very first community of practice, and the title of that is Navigation Reimagined. And these are strategies that move patients and screening outcomes forward. So this is going to be a peer-to-peer led event. This will be over an 8-week series. So this group will be meeting once a week for 1 hour. Every other week, so twice a month for 1 hour. And the goal is to come together to share best practices, looking at case studies, and building out navigation programs that are really making an impact in your community. The QR code is there. Do we have the links in the chat, please?
Yes, we do. I posted those.
Okay, yep. So we have links in the chat. And also QR code. So thank you for joining us. Don't forget to look for the link to retrieve your 1 hour CME. The second link is not working, is what I just Rosa, try that. Are you able to try the QR code as well? But can we get, Nakel, can we get the proper link in the chat? Must be a broken link there. So we are looking for you to participate in any upcoming events. Regarding your CME for today, if you did not receive a link, if you do not receive a link by tomorrow, end of business, please reply to the email that you received during registration. So when you registered for this event, you received an email confirming your registration. You can also reply to that email just stating that you did not receive a link for your CME, and we would be sure to get that to you. So do we have that? Okay, so there's another link, Rosa. I think we have a link in the chat. Let's try that one. Make sure it's working. Is that link working? Raquel, I'm trying to find it. Apologize. We apologize for that. All right, so we'll few more minutes. Can we show the slides again with the QR codes? Just give a couple more minutes before we close the room so you can capture the link or the QR code for the upcoming event, Navigation Reimagine. We would love to see many of you there to participate in this. It's going to be a game changer when we talk about patient navigation, community health workers, anything around outreach, getting patients in the door so that we could continue to make impact when we talk about preventive medicine, early detection, cancer screenings. One slide forward for Bond slide, workflow excellence. All right, thank you very much.
We have
See you at the next event, everyone.
Thank you.
Have an amazing rest of your week.